The connection is stable. That's good. Seems.
Yes, it is. Okay. I don't know if there are some answers to the questions.
I'm not sure completely. Maybe it's only me, but I'm not sure if you posted them because I don't see any questions.
I posted them on the chat, but I don't know if they can have access.
I cannot see in the chat. Can anyone see questions from Cédric?
No.
No. That's a little bit
Really?
strange. I don't know if this is something to do with Zoom. It's an application on your phone.
It is
No,
just.
no.
Oh, okay. It is just before the.
No, but if you tell them, I can just write them so everyone can read also in the chat.
Okay,
and
I send again on the chat. Do you see it? No.
Still no questions. No.
It appears maybe there is a technical problem. What can be the contribution of young people?
Yeah, now I can see, but from our colleague Jaromír Chovanec, you probably wrote to him privately before. I don't know, but okay. So I will just post to everyone. We wrote to our colleague only, and he shared this right now. So is these ones?
Yeah.
What can be the contribution of young people to contribute on peace building and sustainable peace in Central African Republic? And do you have some contributions to improve healthcare in the context of IDP camp? These are the questions.
Yeah, they are. Exactly. So I think we can continue so they can take the time to answer, and after we can come back to the questions.
Would you like to collect the answers somewhere?
Yeah. It will be great.
So I can create in the meantime the Jamboard maybe.
Okay.
Mm-hmm.
Like the last time.
Okay. I'll do that in the meantime.
Thank you.
So it's in chat already.
Okay. Yes, it is. try to open it. It is a little bit slow, but yeah, I got it. Perfect.
It seems we might need some time to think after lunch.
Yeah. Yeah. But I think we can continue, and we'll be back. Time for the participant to think and to write something. Okay. I think the last part of our session today is to share a little bit about my journey, and at last to conclude what we start this morning. Okay. On the same website, you can see my video, the video about the prize. I tell many things about myself there, but maybe the problem is that it is not in, it is in French. There is a little part in English, but something we can do is maybe to play it without the sound, so people just can see and we can talk, so it will be. What do you think?
Yeah, that's not fine, I think. Is that on at the same page?
Yeah, on the same page. Just the second movie.
Sorry, it's been closed already, the web page. I'm trying to find it. What was the starting letter of the address?
Notre Dame de ndfbangui.org. Are you on it?
See. Okay.
Yeah.
Okay,
Yeah.
it's here.
Yeah.
I can see it good. So it's the second.
Yeah, the second.
Primordial. Oh, okay.
Wow.
Good. I'll share it from my computer to save your connection. This one, right?
Yeah, it is. Yeah, it is.
Sorry, I'm again not sharing the sound.
Yeah, without sound, because it is
okay.
The sound is in French and the subtitle is in Macedonian, so it cannot help. Yeah.
Охридската академија на хуманизмот, која ги продолжува духовните традиции на Свети Климентовата, прва средновековна школа на хуманизмот во Европа, веќе 13 години ја доделува Светската награда за хуманизам, и таа стана меѓународен символ за Охрид, градот на УНЕСКО, еден од најубавите градови на светот, со милениумска традиција, која зрачи по сите меридијани. Под Даисаку Икеда од Јапонија, Мануел де Оливеира од Португалија, Нобеловците Александар Солзеницин од Русија и Хирта Милер од Германија, Рави Шанкар од Индија, Питер Брук од Франција, Светлин Русев од Бугарија и Џон Ралстон Сол од Канада. Оваа година лауреат на Светската награда за хуманизам за 2019 година е еден од водечките мислители на Европа, Романо Проди од Италија, чие што име ќе биде запишано во мермерното обележје на Долнапорта, со кое Ohrid ќе се прогласи за центар на светскиот хуманизам. 18 јануари 2019 година во 19 часот, куќа на Уранија, Ohrid.
C'est avec beaucoup de joie et d'émotion.
Can we turn off the sun? Because it is in French. Maybe people are not going to understand. So we can talk and we just let the background continue. Is it okay or not?
Now you can hear me. Okay. Now I was muted. Yes, definitely. I think not all of the participants understand French.
Yeah.
So maybe some can read the subtitles and try to understand the Macedonian. But yeah, it's good. Mm-hmm.
But I think we can turn off the sound.
Sure.
There is a place when I speak receiving the prize. It is in English, so we can. I will tell you, to turn on.
Okay.
Okay.
You can continue.
Okay. Mm-hmm. But what I'm saying, I can say it in English now, so it is okay, and we can discuss. About my journey. I think I was born on 1986 in Bangui, in a modest family. I always mention that because it is really important for me, and because I consider myself like someone coming from far. Yeah. Okay. So in a modest family of Fatima at Bangui, the capital city of the Central African Republic, and as all the children of my age, I try to learn, to go to school, and my parents earlier brought me to the church, and I considered also myself like a son of the church, because I learned a lot thanks to church. That is also some particularity of my country. So people sometimes rely to church, to mosques, according their faith, and to grow and to learn. And on the year 2000, I was accepted in the seminarian of Jesus Child from priest from Carmel. Yeah. I had like director the Father Aurelio Gazera, who will speak tomorrow. Yeah, and I passed 3 years for training and education in this seminarian in Bois, and after the end of my college, I come back to Bangui because I would like to learn science, and the science. I was passionate by science, so I come back to Bangui, and I continue my school, and I always keep this link with the priest and with the seminarian. And after my baccalaureate on 2026, I passed the test to attend the medical school. And when I attend the medical school, I faced some challenges in terms because I didn't have a scholarship and it was difficult. I would like to change my orientation, my study orientation, and thanks to Father Stefano for the congregation of Carmelitanian. I was in connection with Dr. Marcel from the Republic Czech, and after that, he introduced me to Siriri that accept to support part of my school fees and gave me some documentation and we continue to collaborate until the end of my studies. And even now we share many things. For example, when I come to Strasbourg, he tried to help me to understand how the European medical system works and how can I get from here to help my people, what is useful or not, because he worked already in Bozoum and he know a bit what happened, what is the reality. So it helped me to be quickly integrated here in this society and in my work office, everything is going well. So when I was younger, at 10, we faced already the first conflict in my country. In 1996. When we lost the great emperor, Bokassa, it is the country was in trouble, and I tried to work with my team in the church to sensitize about peace and things like that. So that's what I did when I was younger, before to go to the seminarium, the seminary. Okay, and after that, after my graduation, the other thing you already know what happened in IDP camp when the war started. Something interesting, when the war started, I was in Bozoum from my internship as part of my medical studies. And it is the first time I faced rebels. And one of the important thing I experienced there is when a rebel pointed his gun on me, and to oblige me to treat him fast. In the same time, I was prepared to go to the operation room for a cesarean. A pregnant woman faced some difficulties to deliver her baby, and we need to perform surgery to deliver the baby. And this rebel fell on his motorbike, and during this time, when he came to the hospital, the operation room was very ready to start. So they are waiting for me, and I come just to see if the situation is worse or how is the situation. And after a quick checking, I understand and conclude that there is no emergency, and some nurse can help him, and so he can go back home. And he refused. He said that because he is is a soldier, even if he isn't, because he's a rebel, because he had a gun. He asked me to treat him first, and just in this time I said no, it is not possible, because we have 2 lives in the operation room, and you are safe. You just have some wounds, and there is no need to waste time here. If I take the time to treat you, we will lose even maybe the baby, surely the baby, maybe the mother also. And I refuse, and I go. I try to go to join my operation room, and he tried to point his gun on me to stop me, and I refuse, and I continue. I go to the. Fortunately for me, he didn't shoot. So and I perform my surgery, and after that, I come back, and when I come back, I understand that he didn't shoot, because his chief just arrived on the same time and cry on it to not do something. Yeah, that is why after this time, after the operation, and I came, and I treat him correctly, and he go back home, and I was scared just after everything. When I slept at night, I try to imagine what's happened. Even my nurses and my colleague was so afraid. Yeah, but after that, I think that my life is going to change by this experience, and that is why I think I find also the energy to continue during the war, to cross some quarters, even to go to the under bracket massive quarters, because it was difficult to move from a quarter to another. And during that, an international NGO come to Bangui, and with some drugs and medicine, but they need physician to check patient before. So a young people in my quarter call me and tell me that there are some people who need help, and if you can. And I go, I work with them, and we go even in the biggest mosque in of Bangui, and in Fatima's parish, to work and to treat patients. And after that, they said that they didn't have so much money to pay me after that, but how much did I need to get from them? I just say nothing, because they just come to help us, and if we can contribute also, this is our contribution as a citizen, as nation. And I forget that, and I continue my journey. I did what I was supposed to do, and I continue. And after my graduation, I was selected from the yearly program, is Young African Leaders Initiative program, which was a program launched by the former American President Barack Obama to support, to build the capability of young African leaders. Because in young school, in grammar school, I was so committed in youth association to work against HIV, malaria, sexual reproduction, and things like that. So I was selected after what I did also in IDP camps to take part to this program. So I go to Nairobi in Kenya and US at Indiana University for a fellowship. And I went also in South Korea thanks to the Archbishop of Bangui, who accepted to send me there to learn new things, new methods, to see how things work there. It's like what I'm doing here. But in South Korea, I was just a general physician, but here I'm measuring. So that is just the difference. And I learn a lot, and I come back to the Central African Republic, and I was accepted in as civil servant. I integrate, and I was sent I was appointed to Ndele, a city in the north of the country, entirely controlled by rebels. Yeah, so I worked for more than 3 months with rebels. You don't have justice. We don't have official organization, representation of the state. It was difficult, but fortunately I was safe because they also need they also need some healthcare and things like that. So if you are a physician and you don't you don't participate in politics, so you can work as normally. Okay, that's what we did, and I tried to work in this area, this difficult area, and I apply for nephrology in Dakar, in Senegal, because we just, as I said before, we just have one nephrologist for all the country. And according to my professor in Senegal, a country which does not have a dialysis center is a criminal country, because if we have an acute kidney injury in Africa, the first cause is obstetrical, and if we don't have dialysis, we can lose a lot of women and even babies. So it is important to have this center in our country, and that is why I chose this option to go and to learn and to come back also and to teach, because we just have one nephrologist, but we don't have a professor in nephrology. So we need to have a professor coming from abroad, maybe every 3 years or 2 years to teach students. But as you may know, in the medical area, learning need to have also a mentor with you every time to learn better. That is also one of the reality that encouraged me to go and to learn about to major in nephrology. And I'm also optimistic because I think that things are going to change. Even if it will take time, but I'm positive. So we need to work hard and to continue to not be limited on what we can bring to support our country and our population. And when I was in Senegal, the NGO with whom I work in the past during the war to take care of patients was Synergy, was selected by the World Academy of Humanism to propose some nominees, and I was one of the 4 nominees, young nominees around the world, with someone from Sri Lanka, someone from Nigeria, and another young man from Togo. So I was selected for the prize, and I went to Macedonia. It is a symbolic prize, yeah, but as you saw on the movies, it was a strong symbol for young people in my country, and I think it inspires them to work hard and to be committed and to transform their community. Yes. So since November, I'm in France, in Strasbourg for an internship, because there is a partnership between my university in Dakar and the University of Strasbourg in France. So I'm a part of this partnership to come here and to learn. And here I try to learn a lot, as much as I can, because I try to attend also another program in nephrology at the University of Sorbonne in Paris online, so that can help me to improve my level. And once back home at the end of this year in Central African Republic, I hope that I can be helpful for my fellow citizens. Yeah, that's all about myself. It is difficult to talk about oneself, but I try my best. Okay, thank you so much. If there are some questions, I will be able to answer. I'm available for that. Yeah.
Thank you very much, Cédric, for sharing your inspirational and strong personal journey. And it's really inspiring for us, I guess. And it was really a good example of interpreting yourself in the video. So it was also interesting to see you interpreting yourself in in English, speaking originally French, being translated to Macedonian, and in your own presentation. So shall we discontinue the video in the meantime?
Yes, there is a part, my statement. If we come to my statement, you can stop it. Or I don't know if there is a way for you to go directly to my statement.
Sorry, I'm just reading chat now. I've got a question if we can share the link for the video. Hopefully it's working, but I'll share this later on when it's finished, because I'm not sure. Can you? No, you can see only, because I cannot share this while I'm sharing the screen. But
I think you can stop it, because maybe there is a problem. It is not the same thing right now. Yeah.
It's something else than you expected, or Shall I?
Yeah, I think it is mixed, but it is not because of you. Maybe on the website there is a little.
This one? Okay.
Yeah. It is okay.
So I'll start from here. No, from
here.
From here. Okay, it's just now.
Coming.
It's just about to come. Okay. So in the meantime, you can think also, all of us can think about any questions we have related to Cédric's personal journey, as well as the topic of our discussion today, the health care provision in IDP camps, refugee camps, and also about anything you shared with us before related to the health care provision in Central African Republic in general, right? And then we can maybe discuss. And also there are still these questions from Cédric in our gem board. The link is in chat, so please also pay attention to this.
De notre monde d'aujourd'hui.
Is the question on the chat or on the?
No. The question. I mean your questions that are part of the gem board, the link that was shared. But now let's watch this, I guess. Yep. Can you hear?
Chunk of
science. Yes, I can.
Became medical doctor.
Yeah, you can put the.
After he became medical doctor, he did the same dedication to people, and he has done all that being young, and this is a fantastic achievement, because it's not a prize given to a normal people, but to a young, dedicated guy. And what I am wishing him is that this country, that is one of the poorest countries in the world, can achieve the same result that we have seen here for Macedonia. Of course, this will need an incredible effort and incredible change of mentality of European leaders, of Chinese leaders, of American leaders, because we cannot stand that Central Africa will be so neglected and so poor, And I'm very grateful that Cédric has done all his best to start the new era for his own country. And he has given us an example that we have to follow. Thank you, Cédric.
Thank you so much. Ladies and gentlemen, I'm speechless. I'm really honored to be here today in this beautiful country. I love this country. With amazing people, and especially here in this room, with venerable people and professor. Thank you so much, Excellence, for these kind and warm words you come just to say. And thank you so much, Professor Zan Mitrev, for your presentation. By this presentation, I got 2 lessons. Stay optimist, you said. Yeah, that inspired me a lot. Being optimist is very important for a country like mine in this moment. And you also said that the value of life is pertaining to the level of medicine in a country. And that's true also. My country, as Excellence said, is one of the poorest countries in the world, according to the report of the United Nations Development Program. It is also one of the richest countries in the world in terms of natural resources. Yeah, after the Democratic Republic of Congo, because we share the same land. And this country is big in terms of land, like France plus Belgium. It is a big country with many resources, but it still remains one of the poorest in the world. And that to say, the quality of health is very poor. Not because we don't have resources, but resources are oriented in everything, in other things done in health. That is why I'm committed to learn hard and to work hard to support the health in my country. And Professor Zanmitrev is a great inspiration for me. Macedonia is a great inspiration for me. And to conclude, look at the world today. Look at many people who are suffering around the world. Look at the terrorist attack. Look at the climate change challenge. Look at the immigration challenge. It is important to ask this question: what does humanism mean? Humanism, according to me, I am humble, and I think that humanism is not doing extraordinary things with extraordinary means. I think you agree with me, because if that is the definition of humanism, I'm sure that I can't be here today to receive this prize. Humanism, I think, is doing good things with ordinary means. A smile, even just a smile, is a great definition of humanism. So thank you so much for being here, for this honor. Thank you.
Merci beaucoup, je me trouve vraiment merveilleux ici dans cette
Thank you, John. I think the English part is yeah, yes.
It's a shame we cannot applaud here, and you cannot hear our applause as well. But at least,
yeah, maybe I will find a way to send it to you for people if they need it. Yeah,
I'll share the link with them later.
Okay, thank you.
Shall I keep it on? Or
no, it is not necessary. Yeah, we can continue. There is no problem. You can stop it.
I'll share the link to the chat. So
okay.
There are 3 videos in the middle of the website. So that was great to hear about yourself, and to also be able to imagine not a typical life, but extraordinary life, I would say, but of a person that is dedicated to his country and to good thing, the humanity, and to health and well-being of the people in Central African Republic.
Thank you so much. Thank you. And so let's come back to the question. Maybe we can, can I see the question?
Which question you mean? Your questions?
No, not mine, but I understood that there is someone who asked a question.
Yeah, there was a question if we can share the link for the video. So
Okay,
I just shared it, but then there are already some answers to your questions previously in the Jamboard.
Okay, great. So let's check it.
And in the meantime, we can think about questions we have for Cédric related to any part of this meeting, because we have got 40 minutes left.
I think I talk a lot. Now I'm going to listen to listen and to answer a question if possible.
So let's leave space for the question now. In the meantime, while people are thinking, maybe if you want somehow to reflect on the inputs on the Jamboard, I will share the link again.
Okay. Thank you.
Do you want?
I think I see here what can be the contribution of young people to contribute on peace building and sustainable peace in CAR. An answer: they can help humanitarian organizations bring new ideas to projects. Yes, absolutely, because the younger generation live different lives. Okay, such as mastering new technical device and a social network that can help in different ways, raising money for activities. I totally agree with this answer because if that is one thing we try to share among young people. Our country maybe is ruled by people who maybe are in the evening of their life. That is why maybe they don't want to make the choice for the future, the new generation. And we have to contribute, because if we don't contribute, people are going to decide for us. People are going to give us something we maybe don't need necessarily. So it is important for us to contribute in the humanitarian organization and to provide our input on their project. That is really interesting. Edification, sharing the knowledge about the problematic with general public, giving voice to people who are affected by the crisis, leading to increased interest in CAR. Yeah, sure. Yeah, we need to share more about the problematic of the country, because due to lack of education, the big part, the huge part of the population is not aware on what is happening, what context, what choice leaders are doing for the country. And as I used to say, we are in a country where more than 70% of the population cannot read or write, but they are going to choose leaders for us. Yeah, people who are calling intellectuals are living in the capital city are just a few. But if an election is clear, is just and impartial, I think the people who are going to decide for the rulers are those living in a rural area with no access maybe to education. So they are going to decide for the country. That is why we need to sensitize every time, but to help the majority of the population to have access to school and to good health care, so we can help the country to grow. By telling that, I remember a question from a Kenyan fellow when I was in Kenya, and he didn't know very well the Central African Republic. And because when we talk about Central African Republic, people think about the Central African region. Yeah, but they don't try to understand if it is a country or it is a region. So when we discuss, he asked about the land of the country. It is so big, and I try to explain to him. And when he asked about the population, I say we have 5 million. He say, but that is crazy. And he asked me if in my country, everyone has just the right to have one child. I said, but what can you ask this kind of question? And he told me, but you have big land, but you are just a few. So I'm going to ask myself if in your country, like we saw in the past in some countries, people just have the right to have one child. And I say no. And that's helped me to think and to figure out about this issue. Why we do have a big land and we are just a few. Yeah, I know that in the past, due to the colonization and the slavery, we have many deportation from a part of the country, the east part of the country, yes. But after all these days, these years or these decades, the number of the population doesn't grow. And the answer, the big part of the answer is in our healthcare system, because we lose a lot of children. Yes, a lot of children, and the people don't live for a long time also. So it is difficult for us to have a high number of the population of our country. So that is a real problem. And if we don't have many people, we still have an economic problem, because if you produce a lot, but you cannot find people to buy, and for an landlocked country like Central African Republic, it is very difficult. Okay, so it is important to work on that, on education and sensitization of the population. That is really important. And may the young people, okay, I think this is in, yeah, it is here. And may the young people from different countries could work together on some project with the young generation in CAR. Sure, I think we need this kind of links. That is why in the past I try also to travel in other African countries, because we have two big issues. Yeah, the first issues, people, leaders used to say that because we are a post-colonial country, that is why nothing is working. Yeah, it is not true, because we have also many post-colonial countries in Africa, but they try to move on. They try to move on. I accept also that there is a part of this legacy of the colonization who try to stop us to move, but it is not the only reason for what the Central African Republic is not developed like the other African countries, because they are the new colonization, they knew many problems like us, but they try to find a way to move on so we can work hard and to move on. And also, seeing the situation sometimes from abroad, people say, but these people, what did they do? They don't need peace, they don't work hard. And it is not entirely true also, because we have people who try to work, but we do have people also who destroy what others are doing. And we have a long time of bad governance that impact negatively the country, and we cannot progress. So I think we need, as a new generation, we have to find our challenges, the challenges of our time, and work on it, not to live in the past and just to accuse others, but to work. And we don't need also to accuse just ourselves every time, to say that everything which happens is for our faults. Even a baby delivered today, it is his fault. No, it is also, we have our part of responsibility, and we have also to work on these kind of challenges to improve. But we need to find our own challenges and to work on it, not to live in the past. Yeah. Take young people, not ignoring the situation in Ghana. Thank you. So I know that. Spreading information about car and base, yeah, not presenting car only as war and poverty. Thank you so much. LCI young people urgently need education. Yeah, that is true. Involve of girls will be extremely beneficial. I totally agree. I think education is the key, and my gratitude for Czech young people who help us a lot, because even this week, this exchange is a way to spread the reality about Central African Republic and to help things to move on. Thank you so much. Okay. Do you have some contribution to improve healthcare in a context of IDP camp? Send there some humanitarian workers and doctors. Yeah, it is true. It is true. We continue to need doctors and medical staff. Yeah, and maybe the other thing is also to help training people locally, as we said before, and to help that after the emergencies, the emergency situations, the local population can stand up and continue the work. I think usually there is a lack of a transition if we have humanitarian worker, and when they leave, there is a problem for the population for adaptation in the new situation. That is also something we need to work in the both sides to improve the situation. Educate people to be aware of basic hygiene standards. Okay, yes, that is a real problem in IDP camp because people are coming from different areas, different education, and it is a real problem, and to make a good sanitation for everyone. And in IDP camp, you necessarily have many people done for few possibility of sanitation, of food, of drinking water. So hygiene is what we have to do, and to educate people for that. More people in medical sector. Sure, but I think a problem for that is the government. The government that, okay, not the government, this is a bad way of thinking. We have many nurses and many people in the health sector trained maybe by the university, by the regional centers and even abroad. But the national healthcare system is so important than private sector and the faith-based sector. So it is difficult for people to find a way. We have many people working in the health sector, but they don't find jobs. So maybe it is important to open something like entrepreneurship in the health sector. It can help, and not that people just stay and to wait for the government to hire them. It is not possible anywhere. The government cannot hire everybody, so they can start something. And it is really important. And we need also not only doctors, but we need the other health worker to support the health system and to allow it to work properly. Try to educate people to believe medicine and observe basic hygiene principles to avoid illness. Yeah, that's what we said before. Educate people to believe in medicine through lectures or in some fun way, and could help teach them first aid. Yes. Yeah, that is true. Maybe, yeah, lecturers. Yeah, that is important, and we can use the new the modern technologies we have on our phones. Yeah, to sensitize and to educate and to teach first aid. I think even if we don't have a better internet connection, but many people there have at least one phone. So it is important to use that like a tool to provide healthcare or to provide education in the health area. Prevention, providing basic medical and hygiene products, yes, in the IDP camp, providing access to clean water, exactly, that is really important. Collaborate with IDPs who can help, use their knowledge and skills, try to prevent inner conflict in the camp or between the IDPs, IDP and an outside community. Yes, that's true, because we used to have many cases of conflict on IDP camp, because as I told, the people come from different areas, and it is not easy. We still to use mediation, conflict resolution skills every time. So it is important to develop a better collaboration within IDPs, so that can help them to, to avoid some tragedies. Mobile clinics can help, yeah. Care firstly needs stability. I totally agree. Now it is very hard to do anything systematic. Yeah, yeah, it's depend of the situation, but it is true. It is true, because without stability and security, it is sometimes difficult for great investment to create important things. But I think we need some important and strategical tools like mobile clinic to change the paradigm and to change the situation locally. But I think also we can try to perform some activities in some areas who are which are a little bit stable, to continue to start something. But because waiting for stability, it can be very long. Even if I'm positive and optimistic always, but if we wait for a total security and stability, it can be more challenging. So we can start maybe by the education sector to make our possible that people are educated, even in IDP camps. Yeah, how pupils or students can continue to learn and to not lose what they know before. Yeah, then following the wash, water, sanitation, and hygiene principles can prevent disease from spreading. Okay, that's true. That's true. Okay, educate people, more people. Okay, I think we make the tower of all the questions. I don't know if there is something to add here or some comments.
I've received the question in the meantime from the participants, anonymous one, and quote, how rebels are limiting your work, and do they force the local doctors work for their own purpose? I mean, he means recruiting local doctors as their combat members. Have you got any particular example?
Could we repeat again?
Yes, I'll post it in here. Sorry, there are two questions.
Okay.
How rebels are limiting to, I'll translate it, to what extent rebels are limiting your work?
Okay.
And do they force the local doctors work for their own purpose? He or she probably means if they try to misuse the doctor's efforts, as you mentioned the example of a man who was pointing a gun at you. So if they try to hijack the doctor's efforts to say not
okay, thank you. This is an interesting question. I think rebels, when they arrive in a city, usually, what I know, usually they try to make the population to be confident, be confident. So they try to avoid to touch hospitals, markets, mosques, or churches. So they try to respect that and to show to the population that they are from their side. But finally, they are going to rapt and to steal the population. But regarding to the doctors, they don't kidnap or rapt doctors or hire doctors for their purpose, because in the hospital they can come to the hospital and to be cured, and they just try to make that the doctor never tell what is the problem. But this is our off, so we cannot tell the secrets of a patient to someone. But they come to the hospital, and in some case, in car, they can send their team and maybe a car to pick the doctor, but freely, just to explain to him that the colonel or the general yeah, is sick and need health care. So it depends. So the doctor can accept or can refuse, but as we are in a humanitarian situation, sometimes it is there is a cooperation in this side to treat them, but mostly doctors ask them to come to the hospital, and because it is safe and secure here in the hospital. And in the city, we have doctors, we have rebels. Doctors used to stay inside the hospital for their security, but we don't have some cases from rapt. But 2 months, just 2 months or not 2 months, 6 months ago, yeah, we have a team of doctors kidnapped by rebels because they refuse the election, the election process, and they maybe thought that people take advantage in the doctor movement to go for election and things like that. But we have some cases, but fortunately, the problem is solved quickly every time that it happens. But they don't kidnap doctors to work for them or to combat with them, because doctor has not many also. They cannot find doctors anywhere. So it is sometimes difficult. In a big city, you can find 1 or 2 or 3 doctors only. So yeah, that is, but they rapt mostly young people, and in some cases, children. Yeah.
Thank you, Cédric. I hope that this question was answered for those asking.
Okay, so can I share my screen to conclude? I have a slide for the conclusion. Okay. Do you get it?
Yes, we can see.
Okay, thank you. As conclusion, I think that the case of the Central African Republic is a chronic, I call that like that, chronic humanitarian situation. an unprecedented and unfortunately forgotten crisis. Yeah, this crisis is forgotten and is chronic. And for decade to decades, we have crisis. And an important thing, I call it a trap in this crisis is that if you try to see the situation of the Central African Republic these last maybe 30 years, you can see that every 10 years we have a trouble, we have a war, a coup d'etat, yeah, rebels who take power by violence. And by doing that, the cycle of the education is always stopped. That is why currently it is difficult to find many people who are many citizens who complete their studies correctly. Yeah, that is a real problem. And this problem has a big impact, but negative impact on education also. And so we are in a vicious cycle, and it is very, very difficult. That is why working on peace and stability should be a priority for our leaders, for our partners, for everyone who wants really the Central African Republic to move on. The very fragile health sector long before has completely deteriorated and only holds up thanks to NGOs. Yeah, I think our health system is fragile before the crisis, and the crisis come and make the situation worse. Yeah. However, there are some perspectives like working on security, training, good governance, improvement of equipment, but also the will of the population and the young people to work hard and to transform their society, to transform their community, because if we need change, we have to work for this change. That's what I can say to conclude my presentation for the day. So I don't know how to pronounce it, Dekuji or yeah, Singila Mingi, yes. So that's, thank you so much. If you have questions, I'm available. I think we still have maybe few minutes for that.
Yes, sure. Singila to you, Damien.
Thank you. Merci, Singila.
So let's give space to some last questions. There's already an applause from Martina.
Is there any question?
Seems we have already asked what we got in our minds. Maybe some questions will come later, definitely. But I hope this is definitely not the last time that our students and us here at Caritas College would have the same the opportunity to meet you. So maybe. hopefully in the future. But any space for the last question right here? I think we have got, I would have many questions when we have discussed a lot of them already, but it's not for 8 minutes a long answer. It's for many hours of discussion. So, and the challenges are really, really strong, but we are very grateful to be able to see some perspectives, how to move forward in the situation. And I would like to thank you very much again for your presentation, interactive one, as well as sharing some of the videos and sharing your personal story, which is very inspirational, and it's good for all of us to imagine at least something on your personal story. And thank you very much for your constructive approach also to the situation, because as we are discussing the entire week, the situation in Central African Republic is not good, but there are definitely a lot of strengths and a lot of capacities to build on to improve the situation in there. Sorry, just a colleague of mine is asking me because I'm replacing a lot of my colleagues as in a role of moderator, and I'm now multitasking. So I'll just share a questionnaire, a survey we have for the students and the participants. So I will just share this in chat so we can gather some feedback, and we can then build on this in the following days. And also we can share this with you. There will be probably a lot of ideas maybe for future cooperation. So let me just find the survey link, what a colleague shared with me.
Okay.
Sorry, I can. Jana just share this. Thank you. So there is a link already. Thank you, Jana.
Okay.
Dankeschön, Jana. She's a German teacher and also deputy director here. So, Singila, again, thank you very much. It was a great pleasure for us to have you here. And Sharka has got a lot of questions, but you already answered a lot of them. That's probably why there are no other questions in, but we have got a really short time right now. So thank you very much, Cédric. Again, it was a great pleasure to have you, and hope to see you in person soon. And good luck with all your endeavors and all your efforts.
Thank you so much, Jan, and I want to thank everyone who make this week and this conference possible. I think it is a good thing to think about these kinds of crisis, and I wish all the best for your university, organization, and your students. All the pleasure is mine. Thank you so much. See you.
Thank you.
You're welcome.
Au revoir.
Au revoir.